Welcome back to Midday Kentucky, everyone, with Dr. Henry Wells, board-certified plastic surgeon and Wells Plastic Surgery and Skincare owner. We're talking a little bit about something that has been in my family, and we're talking about larger ears. My younger brother and my older sister had that issue, and we're talking about the surgery, ear pinning, but the clinical word for that is?
The procedure is called an otoplasty.
Otoplasty. Explain to everyone at home, Dr. Wells, what that actually is and how it's performed.
Well, the most common problem is prominent ears, and the reason they are prominent is that this fold is flattened in the ear, and the procedure that we do is to recreate the fold and put permanent sutures in the cartilage to maintain that fold. We do that through an incision behind the ear so there's no visible scar.
Okay, now with age, let's talk about, I know that you have some young patients that come in as well. Is there a difference between doing it on someone who's older and younger?
Well, it's probably easier to do on an older patient.
Is it?
And an older patient, the ear is fully grown, and of course their post-operative recovery is a little bit more easy to manage. But children are usually the ideal patients before they are subject to bullying and teasing in school, and usually that's around 5, 6 years of age.
Okay, and you were telling me off camera that you can't really do a procedure like this until their ears are at a full growth?
Right. At 5 years of age, the ear is probably 90% of its full growth. Under the age of 4, it's probably less than 75%, so you don't want to do it at that age.
I've often seen some kids who've had it done, and it almost looks like they've been pulled back too far, like it's very tight. Is there a certain way that you have to do that so you have that still so it looks natural?
Well, you just have to use good surgical judgment when you're doing the surgery, and you don't want to overcorrect. And you certainly want to make them look as normal as possible.
You have a young guy that you're dealing with as well. His name's Reynold. Tell us a little bit about that.
Well, Ryland's a great kid, and it was actually his idea to have surgery, and I think that's really the best way for most children. He was about 6 years of age.
And he knew what was to be done?
Yeah, he had been teased at school and bullied at school. He kind of dreaded going to school, and he was being teased about his ears, and he wanted something done about that.
Okay, so how long is the procedure when you go in there? Talk us through the process.
It takes about 2 hours to do an otoplasty, and basically you can do it under local, but with children, of course, you do it under general anesthesia. And it's a very simple procedure. There's a small incision behind the ears. We fold the ear back, put the sutures in, and put a head dressing on afterwards.
Oh, got you.
Yeah.
How long is that head dressing on for?
Well, with children, I can hardly keep it on more than 3 days. But usually 3 or 4 days, and then they sleep with a headband on for about a week after that.
I got you.
They typically go back to school after about a week, and they resume all of their normal activities after about 3 weeks.
Okay. Is the downtime, you're saying about a week to 2 weeks before it's, up and ready?
They can usually go back to school and interact socially with other children at 1 week.
Talk to me a little bit about, is it true that when you have your ears pinned back that you have to be careful with helmets and riding push bikes because of the rubbing of the helmets?
Well, for the first week you have to protect them.
Yeah.
And we do that with either the head dressing or the headband. After about 3 weeks, you really don't have to worry too much about that, but I wouldn't do any kind of contact sports or wear perhaps a helmet for about 6 to 8 weeks.
All right. Well, Dr. Wells, thank you. We really appreciate it. If you want to find out more information about Dr. Wells and Wells Plastic Surgery and Skincare, there is all the information there. I think it's an amazing operation that you can offer for young kids because it's not necessarily about vanity. It's about stopping the bullying, which I think is seriously important. We appreciate it. We'll be right back after this short break, everyone.